So, hello ma'am. I'm Jessamine Serrano, your nurse for today. So, today we were going to perform oral hygiene. So, first, identify the patient, at least 2 identifiers. So, ma'am, what is your name?
Ellen Ginea Garcia, ma'am.
When is your birthday, ma'am?
August 9, 2003 po.
Okay, ma'am. So, next is assess the environment for safety. So, you will see that the patient is safe on her bed. Next is, we will perform the hand hygiene and we will apply clean gloves. So my hands is not visibly soiled, so I will just put hand sanitizer. And now, we will apply clean gloves. So next, after performing hand hygiene and applying gloves, so we will instruct the patient on not to bite down and inspect the teeth, lips, mucosa, palate, and gums of the patient. So next is we will identify the common oral problems. So I can see that the patient have no problems on her mouth or teeth. Is remove gloves and perform hand hygiene. So I will remove my gloves and dispose it to the proper receptacle. Then I will perform hand hygiene again. So next is review the medical record and assess the oral hygiene problem of the patient. So I can see that there's no medical record of the patient on the problems of oral. That is, we will determine the patient's oral hygiene practices. So ma'am, how will you clean your teeth, ma'am? By brushing ba or by just using mouthwash?
Brushing 2 times a day. Before I sleep and before, after the morning. After morning, I study.
Okay, ma'am, thank you. So next is assess patient to grasp or manipulate the toothbrush. So, ma'am, can you hold the toothbrush ba or not?
Where's the toothbrush?
Here, ma'am.
No.
So the patient can hold the toothbrush, so I can do the rest to brush her teeth. After assessment, next is planning. So number 1 is identified expected outcomes. So number 2 is gathered equipment and supplies. So here's our supplies. The towel, the water, the mouthwash, the floss, toothbrush and toothpaste, and the BC. So next is planning. So number 1 is identified expected outcomes. Number 2 is gathered equipments and supplies. Then number 3 is explain the procedure to the patient and discuss preferences regarding use of oral hygiene aids. So after planning, we will now go on to implementation. So number 1 is perform hand hygiene. So I will use again sanitizer. And next is provide privacy. So I will close the curtain for the patients to feel comfortable and to boost her confidence. So next is arrange the supplies on bedside to reach it easily. So I will put this here. Next is raise the bed on working height. So hindi ko po ma-raise yung bed kasi po kawa lang po yung gamit. So let's assume that the bed is already raised on working height. Then lower the rail. So let's assume din po na nilower ko na po yung rail. Then assist the patient on proper position. So ma'am, can you Can you able to move? So, I will assist you po. You feel comfortable, ma'am? Or hindi? Iba yung ano mo din?
Comfortable.
Okay mo. Next is, place the towel on the chest, over the chest of the patient. So, here, the towel. Then, over the chest of the patient. After that, after putting the towel over the patient, let's perform again hand hygiene and put clean gloves. So, perform hand hygiene. And next is, I will apply clean gloves. Next, after applying gloves, we will put some toothpaste on the toothbrush here at the basin. Then, pour some water on it. So, next is allow patient to hold her toothbrush. Then, if he can't able, so I can do the rest. So, here, I will brush properly her teeth. So I will first clean the side of the teeth. Next side. Up, down motion. Next in the front. Make sure that you will make sure that every area is clean. So let the patient brush her tongue to avoid gag reflex. So you can now brush your tongue, ma'am. Make sure that you brush it properly, ma'am. Okay na po. So next is allow patient to rinse her mouth using water, and you can spill it to the basin. Next is ask the patient if she want to use mouthwash for antiseptic in her mouth. How you want to use mouthwash? Okay, ma'am, just see. Next is help the patient to wipe her mouth. Let's wipe the mouth of the patient by just patting it. So next is allow patient to floss her teeth, or I will just floss her teeth if she can't able to floss her teeth. So it to the proper receptacle. Ano may papakita? Then next is rinse the mouth of the patient.
Okay, hindi. Okay.
Then wipe it. Just patting it. Then ask the patient if she want to put moisturizer on her lips. So, ma'am, do you want to use moisturizer on your lips?
No, it's irritating me.
Okay, ma'am. Assess the patient on the proper position. So, I will remove the towel first. Dispose it to the laundry box. So, I will just position you, ma'am, on your original position. Do you feel now comfortable, ma'am?
Yes.
Okay, ma'am. So next is we will now raise the side rail of the bed for the patient to be safe. And let's assume that the rail of the bed is now raised. So for the safety of the patient to not fall down. Then next is, let's assume that we will now lower the bed on the original position. So let's just assume. So next is we will now remove the basin over the table. So I will just fix the supplies and equipments. Next is I will now wipe the table. Dispose it to the proper laundry box. Then remove the gloves. Dispose it to the proper receptacle. Perform hand hygiene. So, after the implementation, let's now move on to evaluation. So, number one is ask the patient if any of the area of her oral cavity is feel uncomfortable or irritated. So, ma'am, do you feel uncomfortable or irritated in your oral cavity?
No, none.
Okay, ma'am. So next is apply clean gloves, then inspect the oral cavity and perform hand hygiene. Let's assume that I already finished that. So number three is observe patient brushing and flossing practices. So number four is ask the patient to describe the proper hygiene techniques and recommended frequency. So ma'am, can you describe the proper hygiene on your own understanding?
It's good.
Okay, ma'am. So number five is identified unexpected outcomes. So after evaluation, let's move on to recording and reporting. So number one is record the procedure and note the condition of oral cavity in appropriate log. Then number two is report the bleeding, pain, or presence of lesion to the nurse or the in-charge healthcare provider. So that's all for today. I hope you have learned on this oral hygiene care. Thank you.